My name is Dr. Nathapol Arayavatikun. I'm a cardiovascular surgeon in Thailand and have been practicing this for about 18 years. And my dedication or devotion is to adult cardiac surgeries and mainly in minimally invasive way, both in coronary revascularization and valvular surgeries. MICS-CABG is an abbreviation of the minimally invasive cardiac surgeries in coronary artery bypass grafting. That means the patients have less invasive operations, less trauma to the tissues, and get a quicker recovery for the patients and family. Minimally invasive CABG is a new type of cardiac bypass surgeries. In order to avoid the breastbone surgeries, which can have a very long recovery time for over 3 months, and we move the scar into the left lateral side of the heart just below the nipple, about 10 centimeters long. That means the patients can have a very quick recoveries and getting into the daily life within 1 month. I would say that every patient that was consulted to the cardiac surgeons have a good candidate for MICS-CABG, provided that each and every one of the patients have full screening with the CT scan. No wonder that the soft endpoint, like a good recovery, less blood transfusion, less atrial fibrillations, less bleeding, it's quite obvious that MICS-CABG have a superiority over the conventional CABG. And also, from the evidence that the patients can go back to their early life is quite dramatically different compared to conventional one. Actually, the difference is that the patient have to be on one-lung ventilations in order to make some space on the left chest of the patients for the cardiac surgeons to do the coronary revascularizations. That means that we need a lot of the help or assistance from our anesthesiologist, and the rest is the same. I would say there's no difference compared to conventional one, but only the recovery is quite dramatic.